Some big breaking news. The World Health Organization, an official there, making a stunning admission yesterday that makes Anthony Fauci look like an absolute fool. And now there's some blowback. They're walking it back. Before I get into the details, if you're new here, go ahead and hit the red subscribe button down below, then hit that notification bell so you are the first to know when the latest news is published. Now, the Gateway Pundit reports that the corrupt World Health Organization did a complete 180 on Monday. The World Health Organization admitting that asymptomatic spread of the coronavirus is very rare. Now they're clarifying those remarks. As you know, for months, the world was told that the coronavirus would kill millions in the U.S. alone. Yes, it would, because the virus would be difficult to contain due to asymptomatic transmission and infections. Dr. Maria Van Kerkhove, head of World Health Organization Emergent Diseases and Zoonosis Unit, said at a news briefing from the United Nations Agency Geneva headquarters, said that asymptomatic spread of COVID-19 is very rare. Watch.
Positive. The second part of your question is what proportion of asymptomatic individuals actually transmit. So the way that we look at that is we look at these individuals need to be followed carefully over the course of when they're detected and looking at secondary transmission. We have a number of reports from countries who are doing very detailed contact tracing. They're following asymptomatic cases, they're following contacts, and they're not finding secondary transmission onward. It's very rare. And that much of that is not published in the literature. From the papers that are published, there's one that came out from Singapore looking at a long-term care facility. There are some household transmission studies where you follow individuals over time and you look at the proportion of those that transmit onwards. We are constantly looking at this data and we're trying to get more information from countries to truly answer this question. It still appears to be rare that an asymptomatic individual actually transmits onward.
Now, it seems pretty clear to me what she just said. From the data we have, it still seems to be rare that an asymptomatic person actually transmits onward to a secondary individual. It's very rare. And of course, now they are walking back the comments on the asymptomatic transmission of CV. Let's take a little closer look at this before we go any deeper into the initial remarks. The World Health Organization clarified comments an official made on Monday that called asymptomatic transmission of the coronavirus very rare, saying in a press conference that carriers do take part in spreading the virus, but that more information is needed to know by how much. Okay, but it's rare. The initial statement is stating that it's rare. Now, Mike Adams at Natural News, he notes that for months the world was told to stay home, and if you dare go out in public, wear a mask and stay 6 feet away from each other. And all at once, from that statement that we just saw, they just obliterated any last shred of any argument in favor of mandatory injections, mass lockdowns, quarantines, or contact tracing. And of course, that's why they are walking it back. This announcement should end all lockdowns and terminate injection research. It's all pointless now since the World Health Organization says COVID-19 can only be spread by people with obvious symptoms who are very easy to spot. Now, looking at the CNBC article here that we have on screen, CNBC reports that coronavirus patients without symptoms aren't driving the spread of the virus. That is what the officials said on Monday, casting doubt on concerns by some researchers that the disease could be difficult to contain due to asymptomatic infections. It's all very confusing because first they say this and then they walk it back. Preliminary evidence from the earliest outbreaks indicated that the virus could spread from person-to-person contact, even if the carrier didn't have any symptoms. But now World Health Organization's officials say that while asymptomatic spread can occur, it is not the main way it is being transmitted. Van Kerkhove acknowledged that some studies have indicated asymptomatic or pre-symptomatic spread in nursing home and household settings. They state that if asymptomatic spread proves to not be a main driver of CV transmission, the policy implications could be tremendous. A report from the U.S. Centers for Disease Control and Prevention published on April 1st cited the potential for pre-symptomatic transmission as a reason for the importance of social distancing. Dr. Fauci, Dr. Birx relied on bad data and destroyed the Trump economy and drove 40 million Americans into the unemployment line. Now, on a positive note, despite the lockdowns and mass riots, the economy is bouncing back, but we should have some concern now that since this statement was made by the World Health Organization, now they're very concerned because of the blowback, and they are walking it back. It doesn't change the initial points, though. Now, according to Axios, where the initial report came from, that they're walking back this information, she said the World Health Organization estimates 16% of people are asymptomatic and can transmit the virus. Some models suggest up to 40% of CV transmission might be due to asymptomatic spread, but much more information is needed. She stressed that her comments on Monday were specific to particular studies and did not represent a new policy or direction. The World Health Organization said it regrets saying that asymptomatic spread is very rare. Now, the good news is that President Trump has said enough with the World Health Organization and has decided to defund it, as well as, I believe it's Brazil considering the same thing, backing out of the World Health Organization, because they just can't seem to get their story straight. And that's also bad news for Fauci and Birx, because they're relying on information from this organization to continue to spread their policy disasters. Comment below. We'll see you at the next report. For the Next News Network, I'm Gary Franchi.